Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, whilst providing quality care, and where we also provide tailor-made solutions for hospitals and intensive care units to save money and resources, and where we provide win-win situations for all of our stakeholders and clients. In last week's blog, I talked about we want our dad to be out of ICU, but we don't want him in a nursing home because they can't look after a ventilator and tracheostomy. What should we do? You can check out last week's blog by clicking on the link below this video. And if you're watching this on YouTube, click on the link below this video. That'll get you to our website where you can read the written version of this blog, but also watch the video and have access to more resources. So today's blog post is 5 reasons why intensive care at home creates a safe space for long-term ventilated adults and children and their families. So let's get right into it. Number 1, the focus for intensive care at home, the long-term ventilated clients and their families, is all about on the clients and on the families' needs, which is to be at home with their loved ones. You do not get the same in intensive care, but you do get the intensive care coming into your home, which is why it is so client and family focused, which leads me right into number 2. Our clients are at home, and that's where they should be. That's where they want to be, rather than a long-term stay in intensive care. Long-term ventilated adults and children, as well as the long-term intensive care patients, even if they're not ventilated, they might be medically complex, should be at home, not in intensive care. It's all about creating choice for patients, for clients, and their families. And that's what we do at Intensive Care at Home. We focus on clients and families' choice. Number 3, we are focusing on clients' lives and clients living their lives, not so much on treatment, whilst we're offering treatment and therapy at home as well. The focus is on both. We are focusing on improving the quality of life for our clients and their families. We're also focusing continuing treatment at home, whereas in ICU, the focus is only on treatment, not on quality of life and the individual experience of the client. Number 4, focus is again on quality of life and in some instances on quality of end of life. Some patients in intensive care inevitably approach the end of life, but they can do that at home with our service, Intensive Care at Home, and they can approach the end of life at home, which is so much more patient, family friendly, client friendly, and it's just what clients and their families want. And it also provides a win-win situation. We can help ICUs to free up their in-demand beds, and we therefore create capacity for intensive care units to take in critically ill patients that are in higher need of an ICU bed compared to long-term ICU patients that can go home. And number 5, last but not least, especially in Australia, let's focus on the NDIS for a moment. The National Disability Insurance Scheme, the NDIS. Most intensive care units have no idea that the NDIS, which is where most of our clients now get their funding from, is actually helping intensive care units to empty their ICU beds, and they're not even aware of it. So the NDIS is an established funding stream. It's actually helping clients and families to create choice for them, but it's also creating choice for intensive care units to tap into the funding stream of the NDIS partner with a service like Intensive Care at Home and manage their bed capacity in intensive care. So I hope this is helpful. The focus in next week's blog will be about why intensive care units cannot create a safe space for long-term ventilated ICU patients. Take care for now, and we'll talk next week. Now, if you have a loved one in intensive care and you want to go home with our service, Intensive Care at Home, and if you want to find out how to get funding for our service and how it all works, please contact us on one of the numbers on the top of our website or send me an email to patrick@intensivecareathome.com. That's Patrick just with a K at the end. Please also have a look at our case studies, because there we highlight more about what we can do for our clients, how clients can live at home with ventilation and tracheostomy, and you can look at our case studies. And if you are at home already and you need support for your ventilated loved one at home, and if you have insufficient support or insufficient funding, please contact us as well. We can help you with all of that. And if you are an intensive care nurse or a pediatric intensive care nurse with a minimum of 2 years ICU or pediatric ICU experience, and you ideally have a critical care certificate, please contact us as well. check out our career section on our website. We are currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, in the northern suburbs, Mornington Peninsula, Frankston area, South Gippsland, as well as Wollongong in New South Wales. We are also an NDIS, TAC and DVA approved community service provider in Australia. Have a look at our range of full service provisions. We have also been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare companies. Thank you for watching this video and thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll talk to you in a few days.